Our article is Aggravation of Exercise-Induced Intestinal Injury by Ibuprofen Athletes. The introduction in this is about NSAIDs used to reduce existing or preventing a response of pain related to physical exercise. In training and competition it is used. It is said it increases performance, but there's not enough evidence to show that yet. NSAIDs affect GI mucosa, can put athletes at risk for abdominal distress. NSAIDs with exercise will lead to intestinal injury, and that's their hypothesis.
So for our methods, we had 9 healthy male cyclists or triathletes. They were selected to participate in the study. They went 3 to 10 hours a week doing performance endurance sports as part of their normal lifestyle. For pre-exercise arrangements, the Wmax was assessed before the experiments on a stationary cycle ergometer, and then an electrocardiographic monitoring was performed to exclude cardiac abnormalities. Study design and sampling. All 9 subjects tested consecutively in 4 different situations. The first one was during and after cycling, after intake of ibuprofen. The second one was during and after cycling without ibuprofen. The third one was rest with prior intake of ibuprofen. And the last one was rest without prior ibuprofen intake.
Okay, so for the results part, basically figured out that ibuprofen aggravates exercise-induced intestinal injury. So cycling with ibuprofen resulted in even higher levels of circulating I/FABP. Ibuprofen consumption also increased levels of small intestinal injury at rest. Ibuprofen before exercise increases gastroduodenal and small intestinal permeability. In summary, both gastroduodenal and small intestinal permeability increase after cycling after ibuprofen intake. In addition, a clear relation was found between exercise-induced intestinal injury and small intestinal permeability after exercise.
Good transitions.
And lastly, for the discussion, we just talked about some practical implications, basically, of what's going to happen to your digestive tract. One of the big things is the 1-FABP is a plasma concentration of human intestinal fatty acids. So when that goes up, you know something's off in the stomach. Some things that could happen are hypoperfusion, which decreases the supply of oxygen and nutrients to the stomach. And along with that, you can experience abdominal discomfort, barrier integrity loss, which is basically the ability of the stomach and intestines to keep their contents in that part of the chain at that specific time. And then translocation of bacteria, which is going to affect how you're able to digest everything. The studies were limited. They weren't able to find out the exact mechanisms of what was happening, but some of their limitations were they didn't really check the hydration status of any of their people, as well as anything about their renal function. So you could definitely improve it, but they need to definitely make some statements about it because a lot of people, some up to 90%, use NSAIDs before competitions in certain sports, so it's prevalent and we need to stop it.